Here we are, brother.
Are we live there, bro?
Yes, we are live. Aloha, ladies and gentlemen. Welcome to Facebook Family and Friends with Mel and Charlie. Take it away, Mel.
What's up, guys? Hang on while I do my little thing here. I gotta set this fella up, start a watch party, and we're sharing it. All right, guys. Thank you guys for joining us tonight. Special night tonight. We got joining us tonight Aaron Bear. He's an ICU nurse out at Maui Memorial Hospital. You might remember him. He was on TV not long ago, sharing about the situation out there at Maui Memorial. And he's been very active, very outspoken. And so we invited him on tonight to share with us with the recent case that happened in Hale Makua at the senior facility where a patient tested positive after visiting Maui Memorial. We just wanted to get somebody that's on the ground. Aaron Bear actually works, like I said, as an ICU nurse, but he also works with the COVID unit. So he is well-versed in all of this. We're going to be bringing him on in a very short moment. You know, we come on every night sharing the message, sharing the importance of trying to flatten this curve. We're trying to get everybody to wash your hands, don't touch your face, stay 6 feet away from each other, stay at home. We do that every single night. So what we want you all to do right now, hit the little share button on your screen, on your phone, whatever you're watching this on. Hit the share button so we can get this message out to as many people as we can. And we appreciate you guys joining us. I know last night we had a little reprieve. We had Augie T. Next week, every Wednesday, we'll bring on some light stuff, you know, whether it's comedy or music or whatever. We're just going to have a good time on Wednesdays, the hump day, what I call hump day humor. We got to get some humor in our lives. And I know a lot of you guys, based on the response we got, Charlie, I'm sure you got the same response. They were very, it just brought laughter last night. People got to smile. We also learned or saw the other side of Augie T, which I think a lot of people was very, very surprised that, in fact, he had that human side, that side that actually is a normal person. Also, my YouTube channel, Mel Raposo, if you guys want to catch up on any of the old episodes with the Lieutenant Governor or the Senate President or the Congresswoman, whatever, I have every single one of these there on my YouTube channel. Just go and hit Mel Raposo and you can watch any video that you want. And then the other thing I want to start doing is that if you have a business or you have a service that you are doing for free, we're not going to promote businesses on this for you to make money, but if you are doing something free for the community, and it could be something, it could be a restaurant that provides free delivery, but if you're able to go deliver food or masks or whatever it is, let us know. Private message me and we will promote your product or your service that you are giving to the people in need for free, okay? For free. Tonight, I just was informed that Kauai Baptist Church in partnership with Domino's Pizza, tomorrow, April 17th at 12 noon, they will be giving away free large pizza to the first 100 vehicles that come through. Now, and Domino's is going to match that up to 100 pizzas. So that's 200 free pizzas tomorrow at Domino's. They'll have a drive-through setup. The workers will have masks and gloves. It's completely safe. But my only ask is that, you know, don't go get a free pizza if you can afford to buy one. Okay, they're doing this to provide food for those that need. Okay, so don't all rush out there because it's a free pizza. Kauai Baptist Church, a good friend of mine, Anwar Ali, is working with Domino's to provide 200 households with a large pizza. This is a large pizza. So please, tomorrow, 12 o'clock, stop by Domino's and get your free pizza. Again, if you can afford it, go buy it, okay? Save this for the people that actually have families and can use it, okay? Anything, Charlie, before we bring in the nurse?
No, I do want to take this opportunity to apologize to our regulars as well as newcomers last night. I am very, very sorry. I was disciplined harshly by the missus because I was doing one of these numbers last night. And you try to go 1 hour like this, and I'm pretty sure you're going to throw up by the end of that hour. So I promise I will not be doing that tonight. I'll keep my Ocola in one place, and I'll just stay like this for the rest of the night, okay? There you go. I'm raring to go, Mel. I'm raring to go.
All right, all right. Oh, you know, there was somebody else. I have two people in the waiting room. I have Aaron Bear. There's someone else here that's trying to get in, but we're only going to let Aaron in. Okay, let's let Aaron in right now. I'm not sure who that other one is. It might be Aaron on his cell phone, but we'll find out right now. Let's see. Hang on here. He should be coming in right about now. Anyway,
Maybe washing clothes.
No, man. He was there in the waiting room, so he'll be coming on. He'll be coming on. Wait a minute. Hold on here. He's saying joining. Anyway, Aaron, like I said, Aaron, when the outbreak in Maui, the cluster was identified at Maui Memorial, and I believe 34, if I'm not mistaken, 34 employees tested positive. You know, Aaron came out and shared with the public about how, oh, there he is. There's Aaron right there. How you doing, Aaron? Let me make sure I got you unmuted here. You are unmuted. Can you unmute your?
I think I am.
Oh, there you are. There you go.
How's it going?
Can you hear us okay?
Yep.
All right. Well, thank you for joining us, Aaron. Got a lot of interested people. We got a lot of people from Maui on the call tonight. We got a lot of people interested because of what's going on. We all have individual issues that are on each of our islands. And you know, I just, like I explained to you this morning, I really wanted you to come up and share really what's going on Maui, with Maui Memorial, what happened out there. And my concern was raised last night when we saw the first positive at Halemakua. It was a senior patient that, in fact, not sure if he was even a patient. Yeah, it was a patient that was treated at Maui Memorial, and subsequently, all of the patients that were treated were tested. We have one positive so far, and the other thing is that we wanted to discuss testing, and you know, you're an expert. I already introduced you as an ICU nurse, a registered nurse. Been with Maui Memorial now for a few years. Works in the ICU as well as the COVID unit. So this guy knows his stuff. Aaron, I'm going to turn it over to you. Give us basically, the floor is yours, and I'm sure we'll have questions as the evening goes on.
Okay. Well, first I want to say, can you hear me okay?
Yes.
Perfect, man.
Yes.
Perfect.
Okay. First I want to say, I just want to, you know, one of my coworkers had a rant on Facebook about me this morning, and I just want to apologize to my coworkers in the intensive care unit at Maui Memorial. I was a little bit distracted yesterday, and I was using my phone on the job a little bit, and I kind of got attacked for, you know, everybody's in fear, and I just kind of became a target yesterday, and I just want to apologize to my coworkers if I wasn't helping them enough with tasks in general. And yeah, somebody, you know, one of the nurses that trained me kind of really attacked me on Facebook, and then somehow I got banned from Facebook this morning for a month. You know, and that happened to me once before for posting too much COVID-19 information. There was a lot of chaos in the ICU yesterday pertaining to some potentially exposed patients that we had to move. And then today we had our first staff member that was confirmed positive in the intensive care unit. So everybody's in fear, and I probably got attacked for some, you know, some legitimate reasons. You know, maybe I was definitely a little distracted, and I could have helped out more at certain times yesterday. And I just want to apologize.
I would assume right now tensions at the hospital are high.
Yeah.
I think tensions throughout the state is high. Maui has received a lot of attention. Maui, Molokai, with what happened in Molokai. So I think we understand that, and you know, it's mighty nice of you to do that apology on live Facebook, but appreciate what you guys understanding that we are all feel for you guys over there in Maui. Charlie, that's Charlie
Yeah.
Ona, by the way. I'm sorry. Charlie's a retired police officer. He lived in Maui, worked on Maui. In fact, has his mother-in-law at Halemakua, so it's
Okay.
definitely personal to him, as well as his brother just passed away in New York from COVID last week. So
I'm really sorry to hear that, Charlie.
Thank you. You know, before you go on, first of all, I'd like to say I am so grateful for you being on. I know that, you know, because you've been on the news several times. So I just wanted to say this for people that are watching in, that, you know, our objective is we're going to get the facts, and we want to keep it very, very streamlined to the facts. We're not here to bash the facility itself. We're here to really look at how the community can be informed, as well as hopefully if somebody's watching, how things could change for the better. That's all we want. We want things to become better. We're not here to take pot shots at anybody. And because Mr. Barry is on with us now, you know, he potentially, there may be some legal issues. So I just want to keep it very, very streamlined so we don't tread into those waters. And so I hope the viewers out there respect that, and let's just keep it at that. And we're going to get a lot of information, because I know we're somehow connected, all islands. And so, you know, we're not immune from Maui. We're not immune from the Big Island. So like Mel said, you know, being a former police officer there, you know, Dr. Mills, the ER doc, he's the one that saved my son tons of times with his bad asthma. So I have a lot of respect for that hospital. But I think there's other mechanisms that maybe not functioning properly, or maybe is squeaking a little, that I think we need to work out. So we kind of want to target in all those areas. Okay? Yeah. All righty. Okay, Mel, we're good to go.
Yeah. So Aaron, how did this all start, man? How did this all start there in beautiful Maui? You know, we hear that the cases of COVID occurred well before the notifications were made out, but why don't you start from the beginning and share with us from ground zero where you were, what really happened?
Well, you know, there's right now at Maui Memorial, there's really a complete lack of communication and transparency amongst this amazing Maui Memorial staff that really, you know, trained me how to be a nurse. It's been my only nursing job. I've been there for 11 years. The staff's incredible. A lot of them are long timers that we all started working for the state of Hawaii. And Maui Health System, which is an affiliate of Kaiser, you know, and I really like to call it one and the same at this point, because there is no transparency. There is no way to really navigate the jargon that they use to try to single themselves out as a separate entity as Maui Health System at times when it benefits them. And then they will at times mention that they are Kaiser at other times. So they really have created this gray area for us as staff, not knowing who we work for and what they stand for. You know, I created the change.org memo, or excuse me, petition, singling out 4 individuals that are consistently making decisions that I believe are putting our lives at risk by not being proactive and not paying attention to what is happening in places in like New York City, Detroit, New Orleans, not paying attention to those bad situations and not paying attention to good situations like the San Francisco Bay Area that is addressing this situation appropriately, very proactively, and very kind of strict, and everything's working, and they're really keeping their numbers low. For me, it kind of started, I was, I live in central Maui by the hospital in Wailuku, but I was spending a lot of time on the west side of Maui, Lahaina, Kaanapali area. And, I watch a lot of San Francisco Bay Area news, and I watch a lot of European news, especially when stuff like this happens, because I believe that, there's countries and places that really jump on top of catastrophes and crises, and really, proactively try to prevent death and try to prevent mass destruction and so forth. And, as soon as this, word, was starting to spread about this, I started really watching a lot of San Francisco Bay Area news and listening to the experts that they were putting on TV from Stanford and UCSF. And I have a lot of respect for those places because I grew up there, even though I moved here, almost 30 years ago now. So I was worried that we were doing just absolutely nothing at the hospital to kind of, jump on a proactive bandwagon. I was like, hey, what's going on here? And, Maui's wonderful. We're all kind of walking around in a daze. Jokingly, I say, it's bliss here. Work life's good, family life's good for a lot of us. It's a great place to live, and people, we're not really paying attention to stuff that's going on out there. And something just kind of in my gut was like telling me this is going to be really bad. And, the San Francisco Bay Area was trying to get all their visitors out of town. They were trying to clear out the hotels. And I was spending a lot of time, like I said, in the Lahaina, Kaanapali area. And over spring break, and just tons of tourists everywhere. And I was like, this looks bad. This looks like potential for our hospital to get completely overwhelmed very quickly, because we only have 29 ICU beds for Maui County, which is Maui, Lanai, and Molokai. And I was like, man, how come nobody's talking about this? No, how come nobody's trying really hard to get these visitors out of the state so that we have enough critical care beds for our residents? And one day I was out getting coffee, and I got kind of pissed off because everybody is out partying and being crazy. And I just went to Ace Hardware and made a sign and stood on the side of the road at the entrance of Kaanapali Resort area saying, please go home now. Maui only has one hospital, and we need the hospital beds for our residents. And I guess that some of that went viral, and some of I caught a little flack from Michael Rembis, the CEO of Maui Health System, and Debbie Walsh, who's the chief operating officer. Apparently, they came to the ICU to talk to me. Was what I heard. They came to the ICU when I wasn't there. Messages were left for with my manager saying they were looking for me. They wanted to talk to me, and I felt that right there in itself was wrong, because I had never met either one of these people, and I felt that it was an intimidation tactic. So I called to set up meetings with them, and I left a few messages trying to set up meetings with the CEO and the chief operating officer. And what happened in retaliation was they contacted my union, and they contacted the head of human resources, and they said, there's an employee that's being very aggressive, trying to get meetings with us, and you need to meet with this guy and see what his problems are. And this was after, they came to the ICU, in the middle of my shift, even though I wasn't there. They came to, really talk to me. So I had a long meeting with HR, my union rep, and I contacted an attorney just in case, because my uncle had a law practice here in Wailuku for 30 years. And I was like, maybe I should just talk to somebody in case these guys are going to be scary or weird. And what happened during that kind of course of time was I had two coworkers in the intensive care unit who normally wear basic surgical masks during flu season. And I experienced one of them being asked to remove their surgical mask because it was policy all of a sudden that we weren't supposed to wear any PPE walking around in the intensive care unit if we weren't coming in contact with an isolation patient or with a COVID-19 rule out patient. At that time, we were just starting to set up our old Wailuku Tower, small, ancient intensive care, our secondary intensive care. We were working on setting that up as the COVID-19 unit. And you know, I asked my managers, you know, why you're asking these people. One of them, you know, these are people that trained me how to be an intensive care nurse. My coworkers that are older, and I love them. And one lady in particular that was asked to remove her mask. Her husband's an MD, and she always wears a surgical mask during flu season because it makes a lot of sense. And the response I got from my assistant managers in the intensive care unit was that if somebody feels they need to wear a surgical mask walking around in the intensive care unit, then they should be at home. If they feel unsafe, they should be at home. And I said, well, nationally, that's not what's going on. Nationally, what these people are doing is very sensible. They're being proactive. We're dealing with a very intense influenza B outbreak. And now we have this new COVID-19 thing that's starting to really affect Italy and Spain and so on and so France and so forth. And I said, you know, that's not right. These are, you know, these people feel comfortable about their jobs when they're wearing these masks. You know, I'm not somebody that's ever really in fear about anything or anyone, or, you know, it wasn't really an issue that I picked up because of my own fear. I just quickly realized that my coworkers around me, a lot of them were getting into a lot of fear because they're watching, you know, basic TV news, and which is, you know, inspires a lot of fear. And I wasn't watching a lot of that. I was starting to research and look at the Stanford medical websites and see what the actual facts were about this. And
Aaron, at this time, you didn't have any positives at Maui Memorial?
No, nothing at this time. Yeah, I don't have a great timeline. In a little bit, I'll give you a phone number of a gentleman, my coworker, who's developing the timeline for some attorneys and for some union purposes. During this course of time, which was a little bit before March 24th, when some memos came out, a little bit before March 24th is when this all kind of went down. One day I was working like a half shift, and I was asked by the nursing supervisors to go down and work this new COVID screening tent that we were setting up in front of the emergency room. And, you know, I had very little kind of my own research under my belt, and there was really nothing coming from the administration to give us any sort of guidelines on how to deal with this. So I went down to our little tent that was set up. I didn't have any in-service, and I spent about 6 to 7 hours screening patients outside of the ER with just a couple of questions and a temperature, and I didn't even have appropriate PPE on. I had a surgical mask on at times. There weren't a lot of supplies made available out there. It just wasn't set up for anything. Nobody knew anything. It was just complete guesswork. There was no guidance coming from the administration. there was no solid guidance coming from our infectious disease specialist at the hospital, Dr. Scott Hoskinson. So I believe that I was exposed probably in that time period, the day after I worked that COVID screening tent. I felt really bad for about 10 days with a headache and a sore throat, but pretty minimal stuff. And of course, I went to work during that time. Actually, no, I called in sick one day. I felt kind of bad. Second or third day in, called in sick one day. But I remember I felt bad for about 7 to 10 days-ish. And then on March 24th, there was a memo released from Gregory Adams, the chief executive of, I believe, all of Kaiser's. I believe they're based in Oakland, California. And Gregory Adams released a memo saying that all of his staff it was okay for them to bring in their own personal PPE from wherever and to wear it on the job to, if it made them feel safe. It was obvious they hadn't done a lot of research yet. They didn't know what was going on, but I remember going, oh, okay, that's cool. Somebody's jumping on this a little bit. And about 5 to 6 hours later, our CEO at Maui Health System, Michael Rembis, released a memo saying that we are an affiliate of Kaiser, and he basically, the gist of the memo was that we are not going to change our PPE policy. You're not allowed to wear any of your own personal PPE, and Kaiser corporate, whatever statement they put out is not what we were to take directive from. During that same period of time, what I'm hearing now is that the normal PPE that was available throughout the hospital on regular medical surgical floors outside of the intensive care unit and outside of the new COVID-19 unit that we were setting up, all the PPE was basically taken away and put in the hands of middle management, locked up, and kind of hard to get access to. During this time period, plenty of staff coming back from vacation throughout the hospital, no screening whatsoever. Nobody allowed to wear any of their own PPE on the floors. Nobody really using hospital PPE other than in, actual specific bacterial viral isolation rooms that were, already, tested positive for some sort of bacterial virus. Go ahead.
Aaron, I'm sorry to interrupt, but
yeah.
So we're in the COVID crisis now.
Yeah.
And you have a screening tent outside, and your employees are out running the screening tent, including yourself.
Yes.
Yeah. And unless you're in a highly toxic, isolated room, you're saying that you guys were not allowed to wear PPE.
Any PPE.
No
whether
mask.
Whether it be our own or the hospitals.
Not even a mask.
Correct. So I believe, let me blurt this out real quick. I believe during this time period, because of their policy decision, everything that's going on now at Maui Memorial and Halemakua and wherever we sent patients back to, this entire situation, I believe, is a result of that time period where Michael Rembis could have easily said, Kaiser Corporate National has a great idea. Come on, bring in your own PPE. There's a potential that could spread a little infection, with misuse, but Kaiser Corporate felt it was a good decision to release that memo just in case this could help possibly spread some infections. And I believe that they successfully prevented a number of infections at other Kaisers, whereas we did not, because our CEO chose to contradict that memo and release his own memo saying exactly the opposite. And you know, some Kaiser corporate staff flew in to address the issue the day before yesterday, I believe, partially because of me releasing the change.org petition, and also because Mehalani Richardson contacted them, discussed this, and then posted the contradictory memos on Hawaii News Now, and basically implicated, by posting those contradictory memos, really kind of implicated the Maui Health System administration in causing all of this, which I believe she's accurate.
Aaron, was there a shortage of PPEs? Was there a shortage of masks?
No. No.
Aaron, let me ask you a couple questions here. And again, I'm just trying to fit the timeline that you've already discussed. Now, with regards to the PPE, we're talking about the unit that you worked in, COVID unit, supposedly isolated, right? Highly infectious. Okay.
Yeah.
Did you folks ever receive training as far as how you don the equipment upon leaving and decon yourself prior to leaving the premises? Have you anybody gone through this kind of training?
Yes. Yeah. So, well, no. I mean, preemptively, no. So basically, what we did, we have a 16-bed intensive care unit, and we have an older intensive care unit that we use as overflow. So basically, as intensive care staff, we started setting up this, COVID unit in our older, smaller Wailuku Tower ICU. So we started setting it up pretty much with zero guidance. And then slowly, after we already had some patients in there, those were all rule out patients. Those were all patients that we, swabbed, and we didn't know if they were positive or not. And, the tests were taking a huge amount of time because the machines were breaking on Oahu. And apparently they were using different labs on the mainland, so on and so forth. So we're starting to put patients into this smaller COVID unit, as we started to call it. And we were, we didn't really have any good guidance there. So a lot of us we had no real protocol for going in and out of the rooms in the beginning. And then some directives, some policies were set up, and we had a manager from another floor come in and help us. And she used to be an intensive care nurse, and she helped us really start implementing these policies and doing everything right. But I believe it was a little bit too late at that point. But at this more so, the concern for me and a lot of people were the other floors, the regular medical surgical floors, where
that's what I wanted to ask you. Here on Kauai, we have 2 medical facilities.
Yeah.
And I'm a security contractor that provides the security. And way before this pandemic hit, we have protocols in place. Should something like that, then we do a complete lockdown.
Yeah.
And because we take care of a lot of long-term care patients.
Yes.
So do you have like a floor that has long-term care patients as well? And was it on lockdown that, you just cannot allow people to freely go in and out of those kind of floors with the potentially that they could spread if it were to happen? Was it in place?
No.
Oh. Wow. Okay. That's alarming.
And this is like making me sick to my stomach, because I've worked here for 11 years. This is my first job out of the hospitality industry. I love the people at this place, and I feel like we were, since these people have taken over Maui health system, especially these people at the top, which seem to have zero empathy or care for the community, the staff, the patients. It seems like they talk out of the side of their mouth, these hollow promises with zero transparency and zero concern. And a lot of us that pay attention and watch people, we already knew this. And really that kind of what a evil head just kind of became totally apparent to people, to a few more people as this progressed. And, I felt the need to really just get extremely vocal as soon as humanly possible to potentially save some lives, to potentially save the possible spread of this, which I think maybe I helped a little bit, but all of this, I believe, could have been avoided. I had Michael Rembis say in front of me the other day to a couple of my coworkers in the intensive care unit. He said, I wish I could know who had been positive. He was coming around the intensive care unit trying to do some after the fact PR and glad handing. And, that statement just seemed completely offensive to me, because this is supposed to be, the head that's guiding from the top. And we've had none of that. The only person that's been kind of watching out for us really is Dr. Scott Hoskinson, our infectious disease doctor, who is was from, early on telling the administration what he thought. I think he was telling them what he thought should be done, but I think they were picking and choosing what they were going to do, because maybe they didn't. I don't know. They don't seem to listen to anybody intelligent or knowledgeable about anything.
That's kind of how our state administration is running right now. But
yeah.
Okay, so you got all these nurses and doctors and support staff and people walking around this hotel, going into the
hospital.
Hospital.
That's okay.
Going into the hospital. I didn't get my wife over here to correct me. No PPE, no masks, going from one room to the next.
Yes.
You could have some cafeteria people delivering food to different rooms. No PPE, no masks. And this is going on for quite a while. And I remember seeing on the news where some of the employees, I think you were probably the most visual, and I have no doubt in my mind that your actions did save lives. So don't minimize that. I think your actions did save lives. Now, take us to the point where you guys discover the first positive, and then lead us into where all of a sudden we have a cluster.
Honestly, I can't tell you that.
I don't need the dates. Just, what happens?
Yeah.
Okay, so all of a sudden you get this first positive, and it's like, oh my God, who did that person come in contact with? Well, Jesus, Christmas, we came in contact with everybody.
I can't remember her name. Her last name's Concilio.
We don't need names, Aaron. We don't need names.
No. Excuse me. I'm reporter Concilio at the Star Advertiser. She told me that she broke the story. So most of us at the hospital found out about it through the press. So I don't know. She's a good person to ask. I don't know all of her sources, but really most of us found out about it. Our managers, the MDs, everybody really, most of us found out about it through the press. And then piecemeal, there were tiny bits of information distributed to some of the staff through emails. But I have no clear timeline of that. My friend and coworker, Matt Flight, is going to be working on that. because he thought the administration was going to get it together. And yesterday he started contacting me and saying, I really need to start helping because this is a catastrophe. And
let me ask you.
Yeah.
Let me ask you. So when the cluster was discovered,
Yes.
what happened to everybody at that point? Was everybody isolated, or take us through that? What happened at that given point?
Well, what I understand, this is all word of mouth. Nobody was told anything. It really was all word of mouth. So the cluster medical surgical units that had the clusters, and I believe there were telemetry units involved as well. Those units were shut down, and then some contact tracking was done to see who needed to be tested, who potentially was exposed, who wasn't. The people that are doing that are a very small group of people and extremely overwhelmed. So a lot of potential contacts have slipped through the cracks, as we discovered yesterday in the intensive care unit, the non-COVID intensive care unit. We moved a couple of patients out that we discovered had potential contact with positive staff on medical surgical floors / telemetry floors. We moved them out of the ICU yesterday because it was like, oh, wait, this patient potentially had contact with this staff member 6 days ago upstairs on one of the regular floors. We, as floor staff registered nurses, one of us realized that yesterday. So these were patients that had possible exposure that were completely missed by, like I'll reiterate, the small group of people that have been in charge of trying to track these positive patients and positive staff throughout the hospital. There was no coordinated effort to do that thoroughly, is from what I understand from our infectious disease specialist. And apparently there is somebody here now from Kaiser Corporate to help do that. That is, hearsay also. But yeah, people were moving around, patients, and staff were moving around with no appropriate tracking. We were working in the COVID-19 unit and bringing in staff from other floors to train them in preparation for opening up another COVID-19 unit. And we were notified that at least one of the people that were brought in to the COVID-19 unit to get trained by us was positive. So, it was completely and still is completely out of control.
So you believe some of the contact tracing, there were some that possibly were not identified.
Oh yes, yeah.
And
we discovered that yesterday as regular floor staff.
And Halimakua was part of that contact testing, I'm assuming.
I haven't heard anything in particular about that patient. So I don't know, we don't know the name of that patient. We don't know if we treated that patient in the intensive care unit. The administration knows, but even since Maui Health System took over the hospital, my amazing managers in the intensive care unit, we have a great manager, we have great assistant managers. They really kind of lost all their power. The Maui Health System, kind of like Kaiser in general, kind of consolidates the power and decision making right at the top. And so our wonderful managers really lost their ability to make sensible decisions for us, the staff.
today, how are there any changes now? I mean, have they made any changes as far as uh, isolating PPE, contact tracing? Is there any? Has it
You know,
improved?
my coworker Matt Flight. He is when Maui Health System took over. He was, I believe, one of our first union representatives, and he has been not very vocal about things for quite a while because I think he got a little burnout in the initial union negotiations with Maui Health System and UNAC, the United Nurses Association of California. He stepped to the plate yesterday, and he's going to be one of the staff members meeting with the Kaiser corporate people tomorrow, I believe, or in the near future. He's going to be able to kind of let people know if they are really going to make some changes or if they're going to let this continue to stay out of control. Our COVID-19 unit has an amazing manager that, like I said, she's an old intensive care nurse. That's an amazing manager. She came in to help set up the unit. The protocols are in place in the COVID-19 unit, and they're doing a great job. Like, I was in there today helping out and learning how to transport patients from the COVID-19 unit to tests and so forth. It's running really well. Our regular intensive care unit is not being run that well right now. So, we had our first positive for sure intensive care staff member today, and we received an email, some sort of contact this morning from one of our assistant managers in the intensive care unit that everybody should come in and get COVID-19 swabbed, nasally swabbed. And so a lot of the staff that wasn't even, working today showed up to have that done. Apparently it's not mandatory. It was the recommendation of Dr. Scott Hoskinson that everybody in the intensive care unit be swabbed because we have a new cluster, potentially.
Not mandatory.
That's what he told me. So I think he's saying what he can say based on the fact that even though he's the most intelligent person to be making decisions, he's not an administrator. So he's got to bow to these four people who don't seem to make intelligent decisions.
What about PPE? Are you guys able to use PPE now? Are they providing you PPE working in ICU or COVID unit or at the testing or the screening tent? Now that's all okay now? Now they had a change of heart and let you wear PPE?
Oh, yeah. So in the COVID-19 unit, we're wearing N95s to enter the unit. You have to be fitted for that before entering the COVID-19 unit. And then on entrance to the hospital, as of a few days ago, we're being screened with a temperature and given a yellow surgical mask to wear anywhere in the hospital, including the regular intensive care unit. Yesterday, we did move out a couple of patients that were possibly exposed. We moved them from the regular ICU to the COVID-19 unit. One of the charge nurses yesterday decided mid-shift when this was all discovered that we should wear N95s, but that is still not policy. The policy today in the regular intensive care unit is that you are required to wear a yellow surgical mask. I asked Dr. Scott Hoskinson about that today. He was only wearing a regular surgical mask in the regular non-COVID ICU. One other physician was only wearing a regular surgical mask. Dr. Hoskinson gave me a lot of data on that. I chose to only wear a yellow surgical mask because I've been tested multiple times now, and I've read enough to know that if I'm not in consistent close contact with somebody, I'm potentially I don't know. I just made that call for myself because I trust Dr. Scott Hoskinson and I mimic what he does, and that's what he was doing today.
Have you had an antibody test?
No, Dr. Miskovich has been talking to some people I know and, trying to get those. I think those will pop up with community testing. I don't believe anybody is going to shell out for that and try to put the work in to get those from a corporation. I don't think our bosses, our administration, aren't going to do that for us.
The only reason I ask is based on what you've been saying, and you kind of had the symptoms. You may not have had the fever, but you had the throat, you had the headache. Yeah. You possibly had the virus, and you got through it. Yes. And now you got the antibody. I mean, my concern is that how many of those staff members and nurses and doctors, how many of them was running around that place infecting others and not even knowing, and Jesus, it could be one of those people that fell through the cracks.
Oh yes.
Then all of a sudden, you end up with this cluster, and I think that was a frustration.
Multiple clusters, yeah.
Yeah, not multiple, and in a cluster is, there's a good chance that we may see more.
Oh yeah, for sure. I believe that, and when Mehalani Richardson interviewed me the other day, I said I believe that our hospital is unsafe until 100% of our staff are tested and continually tested. Approximately every 7 days. One really good company on Maui that's involved with the hospital, Maui Medical Group. They have contracted physicians, that work in the hospital, and they are testing every 7 days. So the hospitalists inside the hospital, some of them, their company is testing them every 7 days. My company, Maui Health System.
Make sure we make the differentiation because I was mistaken this morning. So you have Maui Memorial, which is the hospital that you work at, and that's where the cluster occurred.
Yes.
Then you have Maui Medical.
Yeah, Maui Medical Group. We call it MMG. So they are, they have clinics around the county, and then they have hospitalists inside Maui Memorial to take care. Well, it used to work like they used to just take care of their own Maui Medical Group patients when they got admitted to the facility. I believe they since it's really confusing, but
we're here at Wilcox. We have Wilcox Hospital, and we have a separate company that's contracted that actually has a wing or two wings to take care of their patients as well. So I understand that part. Yeah. It's just really, 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 really frustrating. I know Dr. Miskovich, with his, I believe is a Premier Medical
Group, yeah.
Premier Medical Hawaii or whatever.
Yeah.
He tests every single one of his employees gets tested once a week.
Correct.
All of his employees gets tested once a week. All of his employees gets issued PPE, the real PPE, not this paper crap that you see floating around and that you got to use more than one day. So it's, I think we heard over the last couple of weeks, we've heard the little bits and pieces from one newscast to the next to the Star Advertiser. That's why I wanted you to come on and really paint that picture. Ultimately, at the end of the day, I think it's dangerous. And I think that we are under-reporting the numbers of COVID patients. I've been saying this for a while now, whether they fell through the cracks or whether we're just not testing enough. Do you believe we're testing enough?
No. So, like I, said to Mehalani, I don't believe, any place on the mainland that's having, outbreaks in medical facilities, I shouldn't say any place, a lot of places, they're testing 100% of their staff and they're continually testing them so that we don't spread it to patients, and we don't spread it to coworkers. We don't have a huge staff at Maui Memorial. So it didn't take me watching a lot of news coming out of the Bay Area or the East Coast to realize that we needed to test 100% of our staff. And that's exactly what Dr. Miskovich said in his video, that apparently our administration was involved in discussions with the Department of Health to try to get that video taken down, because he spoke plain truth and, very intelligent thought process of, okay, this is out of control. Let's test 100% of these people so that we don't keep spreading it. That is yet to be done. They're doing this contact testing around, little clusters, but it's not working, obviously.
Aaron,
Yeah.
a question is, right now, knowing with all these problems that you've mentioned, and it seems a lot.
Yes.
Is there did the DOH or any other entity come in and say, hey, you know what, we need to do oversight at this point? Because it doesn't seem, so basically the news that everyone gets from the CEO is basically just saying the same things without nothing getting done, correct?
Yes. Yeah. And I believe he's a decent guy. He just, he's a politician, so politicians talk in circles and they say nothing. And that is what he's doing to us in this time of crisis. We have no real leader that's guiding us through this crisis to help us save our own lives, our coworkers' lives, and our patients' lives. He releases stuff that just says nothing and doesn't help in any way, shape, or form. So, I go to within the hospital system, today I had a 10, 15 minute conversation with Dr. Scott Hoskinson, just because I pulled him aside and I asked him about things and what should be done, what he thought, and to try to feel okay with me talking to people, because people are asking me stuff now. It's apparent that they are not taking all of his recommendations. They're picking the recommendations from him that they want to utilize in their Maui health system, whatever. So, it ended up being 3 or 4 of my ICU registered nurse coworkers talking to him today and getting information that could help us feel comfortable and help us distribute information to other people, including our coworkers, because nothing intelligent is coming from the administration.
So as far as the hospital is concerned, I'm sure that you still have patients on other floors.
Yes.
With the known outbreak that has already occurred on the first run.
Yes.
Is there a lockdown protocol? Like here, we do not allow visitors because we just don't. Is there a lockdown protocol at the hospital?
Yeah, we're not having any visitors. As far as I know, a select few, end of life situations and so forth.
Oh, you are allowing end of life visitors?
I believe, don't quote me on that, but
okay.
I think yes, in certain situations, I'm not positive of that, because all the policies are changing hour by hour, and a lot of the managers, including the COVID-19 unit manager, can't really keep up with the policy changes. She was expressing, she's expressed concerns like that to me, just in the last, day.
Okay, thank you.
We're running out of time, but on a typical day, I'm a patient in your hospital. How many different personnel will come in contact with me? The doctor, the nurse. How many people will?
Well, I think you're pretty much going to be guaranteed at least 3. At the very minimum. You're going to have your primary nurse. Hopefully the physician's going to round and see you. And most likely you're going to have contact with a nurse aide as well. There's a really good chance of that. So at the bare minimum 3, and then depending on your diagnosis, that goes way up. You might also see an occupational therapist. You might also see a physical therapist. You might also see up to 3, 4, 5 different specialists that are on your case as well. That does happen in the ICU.
You got radiology, you got the X-ray guy, you got the CAT scan guy, you got the cardio guy, you got all these different people that come in and out. And what you're saying is that there has never been, or currently they do not have a 100% testing of all the medical staff in that hospital.
Yes, right. Right now I believe the hospital is unsafe and will continue to be unsafe until 100% of us are tested, just like the Maui Medical Group doctors, and we're tested every 7 days. I believe that's the only way, and I'm just a layman. I don't have a lot of education. I'm just a basic registered nurse. And it's common. It's become very clear, if you have any common sense, that's the bare minimum to keep the place safe, is to test everybody and to continually test people. So I was in a way, I was grateful that we had a positive ICU staff member today, so that they blanket tested our ICU staff, because we've been going to community testings to try to get tested. Kaiser clinics have been denying a lot of our staff tests, and the Kaiser clinics have not really wanted to test here. That's been pretty evident, the stories I get from my coworkers. I switched out a Kaiser Health, I have HMSA health insurance. As a Kaiser employee, I can choose to have Kaiser health insurance or HMSA, and I chose to have HMSA insurance because it's a lot safer. I know that Kaiser does weird things like deny healthcare workers a COVID-19 test. I've had multiple coworkers have that issue.
Can I just ask one more question? Have you seen, I would assume since this hit the news, that probably confidence level of families of patients would kind of seek to get their loved one taken out of there, right?
Yes.
I would expect that.
You would
at
think.
This point.
Yeah.
Okay. And the other thing is, the other part of the equation is, aside from all of the hospital staff, like the RNs, like the specialists, we have the back of the house, like the dietary. We have all those people. They're constantly moving on these floors. Yes. Are they tested? Are they being tested at all? And if not, are they blocked off from certain areas, or are they just letting them free reign, just keep on walking wherever they want to go?
Yeah, I work in the COVID-19 unit a lot. So there's limited access now to places like that
But that's just now, right? It wasn't like that before when the outbreak first occurred.
No, not in the beginning. No. Yeah.
Wow.
So really, it's a no-brainer to anybody. Even you don't have to have any knowledge of healthcare to know, whether you work in a hotel or what, or a cruise ship. I used to work on cruise ships. I was in the Seafarers International Union for 5 years and dealt with some outbreaks of stuff on the ship. Very strict protocols when stuff like that happens. I saw nothing like that take place. And I believe that was due to the mismanagement by Maui Health System, in particular, Michael Rembis, CEO, Chief Operating Officer, Debbie Walsh, Chief Nursing Executive, Gary Kienbaum. Primarily those 3 people, and then we had our strategic communications person, Lisa Paulson, chiming in and saying some negative things about the staff to the press, like that we were overreacting. So really, when I made the change.org petition, I threw her in there because I didn't even know about that, and I was upset about that. I called to confirm. Well, it was in papers, but I also called my friends to at the Maui Time to say, did she really say that to you guys? Like, why? You know, she's from the hospitality industry. You know, a friend of mine has her job now in the hospitality industry, a gentleman who used to be a reporter in this state, has her old job in the hospitality industry. And, you know, this person who doesn't have a lot of medical experience is saying that the clinical staff is overreacting. It was appalling to me. So, you know, we have almost 6,000 signatures today. All the physicians that I love and respect in Maui County have signed it. I've had physicians consistently come up to me and say, you're doing the right thing on a daily basis. I've had postal workers, everybody, apparently they're starting to recognize me, probably because of my name more than my face, because I'm wearing a mask a lot. Postal worker today thanked me, recognized my name when I was picking up a package. You know, I was kind of attacked this morning on social media by a coworker for what she thought I wasn't doing things appropriately yesterday on my shift. And whatever, I tried to admit fault when I can. I wasn't helping out enough yesterday. You know, I was a little distracted trying to keep this ball rolling of a little bit of pressure so that more people like Matt Flight, my coworker, would get involved and help us kind of try to get the truth out enough to save some lives.
Well, Aaron, thank you for your time, man. You know, we appreciate what you and all your colleagues do for us. I mean, all your medical professionals. And, you know, I just got one last question, and I mean, I hate to ask, but you anticipate another cluster popping up now with your new staff member testing positive?
Yeah, you know, definitely, you know, I'm expecting that. That's not based on any data that's been distributed by my managers or the administration. The other factor is, you know, a huge amount of us went to Dr. Miskovich's community testing. None of those results are back yet. You know, I had two ER doctors behind me in the car queue the first morning of Keopuolani Park testing in Ka'alui. So there's a lot of staff that are waiting for their results. So the numbers are going to be way different as these test results start to come in, and all of our ICU swabs from today come back. You know, thankfully, our swabs from today, per Dr. Hoskinson, are now going to a lab on Oahu, and our ICU staff swabs today should be back, he said, within 24 to 36 hours. We won't have to wait for a long time like the Miskovich tests from Ka'alui.
Well, Aaron, we wish you guys all the best, man. I know you can't see the comments on Facebook, but please go back to the Facebook. Just go to my page, you'll see it. And you can go and read the comments. Got a lot of support from your friends here in Kauai. Your Facebook page is just real simple, Aaron Bear. Go look him up. I'm sure he has his petition on there. But, you know, just know that we appreciate you coming out. I know it's not easy to speak up like that, but, you know, this is what's happening, people. This is what's happening in our state. This is what's happening in our sister counties. And these are the kinds of things that I've been talking about for a long time, where we're not taking this serious. We're not testing like we should be. We are satisfied, and we're okay with the low numbers, you know. And anyway,
it's all being done wrong. I just want to add that I did get blocked on Facebook today, so I won't be responding to anybody for a month on Facebook. It's the second time that Mr. Zuckerberg has chosen to block me for too much COVID-19 information. He did go on he did do a big press conference and saying he was worried about his workers seeing too much information on the computer when they were working from home. So I got blocked this morning for 30 days for posting too much COVID-19 information.
Well, I hope you don't block me after tonight, but we got Charlie. We can use Charlie's Facebook Live if I get blocked. You know,
Right on, right on. Thank you, guys.
Well, don't leave yet until I could say thank you very, very much for your honesty and your bravery. As I told you before, you know, coming on here, you know, I believe wholeheartedly, and you know what I'm talking about. You're well protected right around. I mean, you're in the open. I know every little chance we get to see of you, it's been like on small snippets on news coverage. But, you know, tonight you got a full, little over an hour, you got a full hour of just letting it all out. And I'm glad you phrased it the way you did, and you gave everybody the information, because you know, for me, and I told this to Mel last night, my son had a massive stroke, and he lives in Wailuku, so I know that's the only facility there.
Yeah.
My other son is I believe he's outgrown it, but every once in a while he'll get, as an adult, he'll get a very, very severe asthma attack. And you know, there's the Lahaina Medical Group, but they usually, you gotta herf it all the way over to Maui Medical.
Yeah.
And you know, Mar Memorial. And so, you know, everything is clustered right there. You've got your dialysis or cancer behind on the backside by the ER. Yeah. You've got the Cameron Center in front of you. You've got the police department in front of you. You got Kaiser on one side. So, you know, you got all of this right on Mahalani. Yeah. So I just want to thank you. You did a good job.
No, I appreciate it. And thanks for what I come from an SFPD family. So thanks for, I respect the police officers a lot. And, you know, we had a lot of them, a lot of kind of turmoil during the first testing in Kahului. A lot of police didn't know what to do. And there was like a little bit of conflict, but I really thank the police officers for what they're doing. The Star Advertiser is going to have, I guess, the weekend story or the weekend piece is going to be on the Maui Memorial situation or something this weekend. And then, I guess that's about it. But I really appreciate you guys. You know, I don't like doing this stuff, and I hate that this all happened, because and I never scripted any of this. I've just tried to tell people what's actually really happening.
And that's what we do, my friend. You know, that's what we do every night. We bring people on to inform and to educate. And we wanted somebody from the ground floor, man. I wanted somebody who was there and can tell us exactly, you know, the news stories. They get about, 90 seconds, possibly maybe a minute, 2 minutes. Yeah. But usually it's a snippet. You get a little bit in the Star Advertiser. So yeah, I just wanted the people to understand, you know, our focus has always been the testing. Yeah. You know, we find out now on Kauai, DLS 70 tests on Kauai since the start of this crisis. Yeah. Found out today, although, and I got to put a disclaimer that I cannot get clinical labs to respond to my phone calls or my emails. I'm asking a simple question. How many tests have you done on Kauai? I don't want to hear 19,232 in the state. I want to know how many have we done on Kauai? Right. I had a source call me today, very reliable, although I cannot get it confirmed with clinical labs because they're not calling me back. But I was told that since the start of this crisis, since the start of this pandemic, clinical labs have tested less than 1,000 people on Kauai. So we're talking about 1,070 on an island that has a population of about 75,000. Remember, when the pandemic started, you got to add the tourists, which is about 20,000 a day. Yeah. So when you add up all those numbers of people that are here, and we tested less than 1,000 tests collectively now, totally, the numbers aren't accurate. Right. Aren't accurate. Yeah. And I hear from you now how many fall through the cracks. That even makes me even more nervous. So
I mean, you should be. I mean, we need, and there's Stanford saying it, UCSF is saying it. Those are the places I pay attention to the most. More testing. Stanford has already antibody tested 100% of their staff, and they're making those tests available to the community as they can. Dr. Scott Hoskins said today he had a hard time getting enough swabs from clinical labs to test our ICU staff. So clinical labs is in Maui Memorial. So he got his testing product from them. I don't know where the tests were sent off to, but he really kind of had to beg to get enough swabs to test all of us. So it's ridiculous.
Everybody's conserving these things. And I'm going to end with this. The president today said, you know, he rolled out his 3-phase reopening America plan, but he's giving the decision to the governors. They said each governor of each state will make the determination. It won't be Trump. It's going to be our governor to make the decision. And there's going to be guidelines. But I will tell you this, and I have watched enough and I've read enough, like yourself, Aaron. And again, thank you for being here. Every single one of those guys have said, do not open until you have widespread testing. Exactly.
So
I mean, everyone is saying that. So it's in Governor Ige's. It's not Trump. I don't want to hear about Trump no more. I just want to, it's in Governor Ige's hands.
Right.
So if he wants to start opening this state, I'm saying he best be doing widespread testing now and covering everybody that can possibly be tested. So with that, sir,
right on, you guys.
Interesting close. We do this every single night.
Right on.
We got a lot of people here that has been commenting about flattening the curve. You see, we started this, and I apologize to all of you that are here every night because you hear this every single night, but we started this a while back. I've had this Facebook Live for over a year, since October of 18. And since COVID started, Charlie's joined me, and we bring on people, we talk, and the focus is really to inform and educate and to remind people to participate in flattening the curve. Stay at home. Don't touch your face. Wash your hands. All of that stuff. And over here, people weren't listening. People weren't listening. So, see, look at all the hearts coming up. They're all waiting for this, man. Everybody.
So let me just throw this in. I'll say it. You know, I've told my friends and my loved ones to make stuff up to get a test. I say, you know, I tell them, you know, make something up. Get tested. If you flew or you were around people you think were positive, I have to say it. Make something up and get a test, because you're potentially going to save lives by getting tested.
Yeah, and you know, we're hearing the stories about people that are going with symptoms and being turned away.
Yeah, exactly.
And I think it's because we don't want to show the massive amount of numbers, because we really want to open the economy. And I want to open the economy. Believe me, I want this economy to open, but I want to see people dropping dead because we opened up too fast. So anyway,
right on.
So tell people you gotta help us flatten the curve. And if you cannot flatten the curve, then Charlie and Mel will flatten the music for you, buddy. Ready, Charlie? 1, 2, 3, go.
Are you ready? Here we go. Good night, everybody.
Aaron Bear, we're praying for you, buddy. We wish you the best. Thank you for joining us tonight. We'll see you guys tomorrow night at 7 o'clock. Love you guys. Stay safe. God bless.
All right.
Aloha.
God bless.